In our last podcast episode, we discussed nutrition for pregnant women. But a healthy lifestyle is, of course, essential for all women, mothers or not. So today we're shifting our focus to overall women's health and wellness. And we are joined again by Nichelle Salazar, a certified nurse midwife at San Juan Health Partners Midwifery and Women's Health. Welcome to Celebrate Health, a podcast from San Juan Regional Medical Center. I'm Caitlin White. Nichelle, so many women put their health last behind work and friends and family. Why should we bump this up on our to-do list and make health a focus instead?
So I tell my patients, and I even have to tell myself this, we can't take care of anybody if we don't take care of ourselves. We do. We tend to put our kids first. Work usually comes before ourselves and whatnot, but if we don't put ourselves first, we can't do that work. We end up getting sick or, the stress gets a little bit too much or, there's just a lot. So it's really, I try to stress it as much as I can to my patients is you need to put yourself first, even if that's taking 5 minutes, a day for yourself to just breathe and relax and recollect your thoughts. We need to put ourselves first because ultimately, too, we are the main ones in the house and the kids will follow us. So if they see us not taking care of ourselves, when they get older, they're not going to be able to, really put boundaries down in certain places, too, because they're like, oh, well, mom worked really, really hard and didn't take care of herself. And, I'm going to be a hard worker like her. So we really need to look at those little people that are looking at us.
No, that is a very good point, and something I also always have to remind myself to put myself first as well. Mm-hmm. So what are some common mistakes that you see women or your patients making when it comes to just maintaining a healthy and balanced lifestyle?
So I think the biggest thing is that not taking time for themselves. There's so much to do. There's little things that you could do to help, like meal prepping, looking at your sources of water. Are you drinking enough water? Treating yourself to a nice little water bottle that can help you throughout the day.
Yeah.
Nutrition-wise, we work really rough hours if you're a working mom, but, even when you're in the home, you're still working really rough hours too, where sometimes it's easy to just stop and get a meal, on your way home. I think taking the time to kind of do a little bit more planning can help decrease that. I think with the meal planning, one of the biggest things is that you get the same meal for the whole week, and sometimes that can be a little bit boring. So, creating variety really helps people sustain changes to their nutrition so much better. Moderation. You don't have to take everything out. When you start restricting yourself so much with certain things, I cannot have a soda, then that's when people have a harder time staying away from soda. But if you treat yourself, with a soda every now and then where it's not completely off limits, I see people do so much better. And some people do better, where they just cut it off completely. But sometimes people say having that ability to be okay, if I have a really stressful day and I just need to have one soda, I can do that, mm-hmm. and I would be okay. It just kind of depends on how they feel or what they feel works best for them.
Mm-hmm. Mm-hmm. No, that's understandable. Well, let's go on that topic to nutrition specifically. What are some supplements or foods that women need to be eating, and what should we just overall know about nutrition?
Supplements, you can do a multivitamin. Like I said with prenatal vitamins, they aren't the end-all, be-all. They fill in the gaps of what our diet may be missing. So super important to make sure, again, balance and a variety to make sure that you're getting all those sources met. Vitamin D is super important. Even if you're not getting a lot of sunlight, you need to have at least a vitamin D supplement. I would say in this area, probably about 70 to 80% of my women are deficient in vitamin D.
Wow.
And a lot of them are actually deficient to the point where we don't even have a number for them.
Wow.
Vitamin D, we're kind of seeing maybe can even increase the risk of depression. So, you think about that infection, it's a good, it helps with immunity. We saw it really big even with COVID. Think about all of that, and it's okay, maybe we need to do a little bit more education about vitamin D. with vitamin D sources, you think about, okay, well, what can I do to increase that in my diet? And again, it's going to be a lot of your fortified foods. I think they have butter that's fortified, orange juice that I've seen, cereals. You could do yogurt. Sardines are really good in vitamin D. Salmon, mackerel, tuna fish, your milk sources, of course. But those are all great sources of vitamin D that we need to increase a little bit. And I think that'll definitely help with immunity and help even maybe in the depression area. Calcium is another big one, especially for teens. Think about your teenage girls. When you're that young, and even in your 20s, you're still building bone mass. And so you need to increase those sources. Here in this area, we don't do a lot of dairy sources, primarily because of lactose intolerance. So talk with your provider or your nutritionist and see what are other sources of calcium that you can get, or do you need a supplement of calcium? Women should be doing about 1,000 milligrams, teens maybe like 1,300 milligrams. The other thing with calcium that I think about too is if you're on birth control, that can also take from your bones. So you need to talk with your provider about that. And just ask the question, because sometimes as providers, you kind of assume because this is our world that we live in all the time. So I always tell patients, please ask me if you have a question about nutrition. And if I don't know the answer, we'll find it out together. Folic acid, again, if you're a woman of childbearing age, even if you aren't planning for a pregnancy at this time, I always tell people it's better to be prepared just in case, because maybe about 46% of the pregnancies here in New Mexico, maybe a couple years back from the data, were unplanned pregnancies, meaning that, they happen. If we could get everybody to take a folic acid supplement, that'll help to reduce those neural tube defects for those pregnancies that may come at us as a surprise. Neural tube defects, which can be caused by folic acid deficiency, usually that occurs in the first month before pregnancy is known. So that just helps to make some prevention there. Other things with nutrition that I always talk about too is staying active. You want to stay active. It's really important. With COVID, we've seen a little bit of that change too. But now is the time to get out, now that the weather's getting better, and just a little bit of walking. 30 minutes a day, 4 or 5 times a week is beneficial. The other thing is taking care of your mouth. That's a big part of nutrition. I think that a lot of us tend to forget. And that's keeping up with your, brushing your teeth, your dental cleanings, protecting those gums, because they can have some negative impact on our health later on if we have a lot of gingivitis. You can be more prone to like cardiovascular disease. In pregnancy, it can be more prone to preterm deliveries and also preeclampsia, gestational diabetes. So it's super important to not forget about that main part of nutrition.
Absolutely. Well, Nichelle, we covered a ton of information here today, and it is a broad topic, women's health. But as we wrap up, is there any more advice that you have to improve a woman's health and wellness?
I think the biggest thing is to, try different things in nutrition. Like growing up, I kind of stuck with the same things that I like, and it was very hard for me to step out of the box. But now that I'm older and I've tried different things, I've added a lot more to my diet, which actually helps me get more nutrients because there are foods that I probably wouldn't have even tried before, But they have maybe good amounts of vitamin C or vitamin D that I would have never tried before. So, get out there, try different things, talk to your provider. Now we're starting to get more information about nutrition, which, we may not have had when we were going through school, but now that we see the benefit of it, we're starting to get a little bit more. And so we're starting to be a little bit more comfortable with that conversation. Ask about the different programs that we have in the community. There's some great programs to help. If somebody's kind of in that pre-diabetes range and wants some help with lifestyle changes before doing anything with medications, we have a program for that. So there's a whole bunch of different things that your provider can help you get in touch with or get information about. So utilize us as a resource. And biggest thing, too, is if you are planning a baby, get preconception care so we can look at all that risk and we can decrease that, make some changes to help improve the chances of a nice, healthy pregnancy.
Well, thanks for stopping by again, Nichelle, and sharing your wisdom with us. We really do appreciate your time. Find out more by calling San Juan Health Partners Midwifery and Women's Health at 505-609-2590. That's 505-609-2590. And thanks for listening to Celebrate Health, the podcast from San Juan Regional Medical Center. I'm Caitlin White. Stay well.